Good morning, everyone. Certainly like to welcome everyone here today. I appreciate the fact that our uh, we have our honored guest here today to actually help us usher in the services that we currently provide here at Langston General Health. We are honored to be a part of the Blueprints program. The Blueprints program has actually certainly been a part of our emergency department. It has certainly worked to have patients that we have come into our emergency department transition to the appropriate level of care in a timely manner. We have received support from our community partners. It's one of the things that we've been proud about as a community organization. We're an anchor institution. We have had several patients that have benefited from these services. We are certainly proud and certainly one of the few organizations that have provided this type of service for these patients throughout our years. We'd like to welcome our department and Tamika Davis to the podium so that she can have a few words.
Thank you. Thank you. Thank you. Thank you, Tracy. On the behalf of the Shapiro administration, I want to thank all of you for being part of Pennsylvania's crisis system, ensuring there's someone to call, someone to respond, and somewhere to go when people need help the most. I am Dr. Latika Davis-Jones, and I have the pleasure of serving as Secretary of Pennsylvania's Department of Drug and Alcohol Programs. Thank you all for being here today. For someone who has just survived an overdose, the hours that follow can shape what happens next. Many individuals come to the emergency department feeling confused, frightened, physically uncomfortable from acute opioid withdrawal, or uncertain about what has happened. Others may feel relief, anger, disbelief, or no emotion at all. Every person's experience is different. These factors and the circumstances leading to an overdose are often complex. Opioid use disorder, an increasingly unpredictable drug supply, untreated mental health conditions, trauma, housing instability, and other social and health challenges. This is one of the most vulnerable moments in a person's life, but it can also be one of the greatest opportunities to build trust, to preserve dignity, and to connect someone to care. Having the right treatment at the right place at the right time can be life-saving. This is where the Shapiro administration's Warm Handoff program comes into play. We're talking about expedient, appropriate, and seamless care for individuals who have overdosed. Rather than leaving someone to fend for themselves, to navigate our treatment and recovery systems on their own, a warm handoff provides a direct and personal connection to care. Providing door-to-door referrals from an emergency department to a treatment facility can make all the difference in saving lives and leading individuals onto a path to recovery. Today, I am proud to highlight the remarkable impact of the Warm Handoff program across Pennsylvania. Since Governor Shapiro took office, Warm Handoff programs have been operating in nearly 170 Pennsylvania hospitals, including right here at Lancaster General. We have recorded more than 93,000 Warm Handoff encounters, each representing the opportunity to assess the need for substance use disorder treatment and connect someone to care when they need it the most. Those encounters have led to almost 68,000 direct referrals to treatment. To put that in perspective, that's more than 10% of Lancaster County's population. For more than a decade, DDAP has partnered with statewide to seamlessly connect overdose survivors to treatment. Today, every local county drug and alcohol office supports a DDAP-approved Warm Handoff program, ensuring access to care with hospitals across Pennsylvania. Our county drug and alcohol offices are the true boots on the ground, managing our collective response to increase overdose prevention and decrease substance use. Every warm handoff is more than a referral. It's a second chance for a brother, a sister, a parent, a friend, a neighbor, or a loved one who has experienced an overdose, where they are definitely met with an opportunity to have care, compassion, and hope, and a pathway to recovery and wellness. Warm Handoff Programs brings DDAP's mission to life by connecting Pennsylvanians to timely evidence-based treatment and a pathway to recovery. This work is only possible because of the dedicated partners with us today. Hospitals like Lancaster General don't just save lives, they help individuals begin recovery, and together we are restoring hope, strengthening communities, and helping Pennsylvanians build healthier lives. With that, I'd like to now turn it over to Dr. Christy Dively to provide some insight into the hospital's Warm Handoff program. Thank you.
Thank you, Secretary. Since January of 2023, Blueprints for Addiction Recovery Specialty Programs has received warm handoff referrals for 119 individuals from Lancaster General Hospital alone. Of those, 39 people, or 33%, engaged in immediate services. 59 individuals did not engage in immediate services, but 44 of those were connected to services after continued outreach attempts and follow-up contacts, reflecting the ongoing efforts to build trust and to encourage connection with the programs. 20 individuals declined services. And for 2026, the program has also received 12 level of care assessment referrals from the emergency department, where the Blueprints team completed assessments for referrals to treatment, further expanding opportunities to connect individuals with care and support. I'd like to introduce the Chief Executive Officer of Blueprints for Addiction Recovery, Benjamin McCoy, to talk about their programs.
Good morning. Thank you, Dr. Dodley. Thank you, Secretary Davis-Jones. Good morning. Thank you all for being here. For more than a decade, our team at Blueprints has worked alongside community partners to identify gaps in services and develop programs that support some of the most vulnerable individuals and families in our community. Through the collaboration and support of our many partners, the Department of Drug and Alcohol Programs, the Lancaster County Drug and Alcohol Commission, and of course, Lancaster General Hospital, we're able to deliver high-quality, person-centered care and expand access to services that truly change lives. Today, it's really exciting to highlight this cornerstone of that work in the Warm Handoff program, particularly our collaboration with Lancaster General Hospital in the Warm Handoff project. When someone arrives in the emergency department following an overdose or another substance use crisis, it's often one of the most vulnerable moments of their lives. It's critical then that we show up for them in the most informed, effective, non-judgmental way possible. Embedding certified peer specialists into our response does exactly that. It offers immediate, trauma-informed support, compassion and connection, and of course, hope that recovery truly is possible. Peer specialists bring something that can't be taught in a classroom. Their lived experience sets them apart as a vital piece of the community health puzzle. They understand the challenges of recovery firsthand and are uniquely positioned to build trust, reduce stigma, and help individuals take the next step toward treatment and recovery. That connection often makes the difference between someone leaving the hospital with a list of resources and someone leaving with a relationship, a plan, and real hope for the future. In fact, the countless individuals I know in recovery, myself among them, would be the first to say that their new lives truly began when people stopped talking at them or to them or about them and began sharing with them. And that's the incredible power of this vital piece that we called Certified Recovery Support and Peer Specialist Services. The Warm Handoff program demonstrates what's possible when healthcare systems, public servants, local and county leadership, and community organizations come together with a shared goal: to ensure that every individual has access to compassionate, effective care when they need it the most. Now, I really am honored to introduce someone whose personal and professional journey reflects this mission. Justin Dettinger is an overdose survivor, a respected leader in the recovery community, and Blueprints' own director of specialty programs. His lived experience, compassion, and leadership have helped shape the many programs like Warm Handoff that are transforming lives in our community every day. So help me welcome Justin.
Happy to have you here.
Hi, everyone. My name is Justin Dettinger. I'm the Director of Specialty Programs at Blueprints for Addiction Recovery. But this morning I'm here to speak to you as an overdose survivor and a person in long-term recovery. After experiencing an overdose, I was connected with the Warm Handoff program right here at Lancaster General Hospital. And as a result, was provided resources that led to my eventual engagement in my own recovery process. Initiatives such as the Warm Handoff are vital to our community and played a direct role in allowing me to be a son, a friend, a father, and in helping me build the life that I have today. I now have the privilege of working in the recovery field and with the Warm Handoff program right here in Lancaster County. I'm incredibly grateful to all the professionals who participate in and make programs like this possible, and for the support that they've offered me along the way throughout my recovery. Thank you to Lancaster General Hospital and to DDAP for allowing me to share a small part of my story with you today. And with that, I'll now turn it back over to Tracy.
Thank you so much. We're going to switch gears a little bit and talk a little bit about the Crisis Walk-In Center. Crisis Walk-In Center, as you know, we had about 5,700 patients that came into our emergency department, and these are patients that had behavioral health conditions. And we wanted to reduce that amount of patients because it resulted in boarding. So I can proud to say about 20% of those patients have been reduced in the sense that they've reduced coming to the emergency department. They have a process now currently in our Crisis Walk-In Center, which Caroline will talk about in just a second, that really provides some immediate assessment, provides some immediate care for those patients. It allows them to have a warm handoff, what we talked about today. And one of the things that I think is important about this, it highlights the partnership between the community, between public agencies, and also health systems like ourselves to being anchor organizations to be able to provide this level of care for these patients. So I'd like to bring up Carolyn Barnhart, who's our director and has been a stalwart in moving that process forward, to come in and talk a little bit more about some of the details.
These conversations about recovery always make me feel emotional because this is about hope, and hope happens in relationships. So I appreciate Justin's story and how he started here, and now he's helping other people. So I'd like to thank the governor and the secretary. We don't get to do this great innovative work without resources and a financial commitment by the state. So the Crisis Walk-In Centers throughout the Commonwealth being included in the governor's budget not only makes a difference here in Lancaster County, but in communities all across the state. And we've seen that patients reach out for help. Often people who have nowhere to turn, have had no idea how to get help. They show up in our Crisis Walk-In Center. They're helped by our addiction medicine team. So in addition to financial resources that are required for innovation, the real work happens every day, 365 days a year, that our team members show up to serve others and to help others. And that team includes our behavioral health intervention team that's here 365 days a year, seeing people in our emergency department and upstairs, our addiction medicine team, and our Crisis Walk-In Center team. And those teams include certified peer support specialists, nurses, psychiatric providers, addiction medicine physicians, care managers, counselors. So today I really celebrate our team, the teams at Blueprints who also show up every single day, 365, 24/7, to be present for people who are suffering and who wish to have a life of hope. So thanks to everyone. Thanks for your time. Thanks to the secretary. I hand it back to you.
Thank you. Thank you. Again, I want to thank everyone for being here today, and I would be remiss if I did not share information about our Get Help Now hotline. This message is for any Pennsylvanian struggling with substance use. Please know that there are resources available for you, and there are trained individuals to help. Pennsylvania's Get Help Now hotline number is available 24 hours a day, 7 days a week, 365 days a year. The number is 1-800-662-HELP or 1-800-662-4357. Whether you're an individual in need of services or a family member inquiring about services for a loved one, trained individuals can help you navigate local treatment options in your area, regardless of if you're insured, uninsured, or underinsured. Remember that asking for help is a sign of strength, not a weakness. Now, I'll open it up for questions. Thank you.
Barbara, you good?
Yeah, talk about the number of people again who have been helped here in Lancaster General Hospital.
Since January of 2023, there were referrals for 119 individuals, 39 people engaged in immediate services, and then 44 were connected to services after further attempts at outreach.
Is there anything else you need with the program or where it could improve?
We always need help. But, I mean, the more people that are supporting the recovery community, the more beneficial it's going to be. And just remembering that they're all just people who need help and need our support.
Thank you.
Thank all of you for being part of Pennsylvania's crisis system, ensuring there's someone to call, someone to respond, and somewhere to go when people need help the most. I am Dr. Lippin. Others may feel relief, anger, disbelief, or no emotion at all. Every person's experience is different. Also be one of the greatest opportunities to build trust, to preserve dignity, and to connect someone to care. Having the right treatment at the right place, appropriate and seamless care for individuals who have overdosed. Rather than leaving someone to fend for themselves, to navigate our treatment and recovery, all the difference in saving lives and leading individuals onto a path to recovery. Today, I am proud. For more than a decade, DDEP has partnered statewide to seamlessly connect overdose survivors to treatment. Today, every local county drug and alcohol office supports a neighbor or a loved one who has experienced an overdose, where they are definitely met with an opportunity handoff program. Thank you. Thank you, Secretary.
Since January of 2023, Blueprints for Addiction Recovery Specialty Program.
To compassionate, effective care when they need it the most. Now, I really am honored to introduce someone whose personal and professional journey often makes the difference between someone leaving the hospital with a list of resources and someone leaving with a relationship, a plan, and real hope for the future. In fact, the countless individuals I know.
Hi, everyone. My name is Justin Dettinger. I'm the Director of Specialty Program.
Team and our Crisis Walk-In Center team. And those teams include certified peer support specialists, nurses, psychiatric providers, addiction medicine physicians, care managers, addiction medicine team. So in addition to financial resources that are required for innovation, the real work happens every day, 300 for people who are suffering and who wish to have a life of hope. So thanks to everyone. Thanks for your